Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. You know, when someone has symptoms of a stroke, it's important to act really fast, so it's important to have a basic understanding. So joining us to give us this important information is board-certified neurologist, Dr. Marwan Shuayto. Dr. Shuayto, welcome to Today's Health.
Thank you, Barb. Thanks for having me.
This is such a common topic, but I admit we don't talk about it often enough. So let's start with the basics. What is a stroke?
Well, there are different kinds of strokes, and sometimes they present with different kinds of symptoms, of course. The most common type of stroke is an ischemic stroke, where blood flow is disrupted to the brain. And there's an image of that right there. There are different things that cause ischemic strokes. Sometimes it's a thrombotic stroke, which means one of the blood vessels is clogged. Sometimes it's an embolic stroke, where sometimes an embolus or a blood clot from somewhere else breaks off and gets to the blood supply of the brain and blocking the blood flow there. And sometimes it is a cryptogenic stroke where there's no known cause for it. But basically all result in the same thing, and that is disruption of blood to the brain. And the brain is very sensitive in its need for oxygen and nutrients, and that's what blood gives our brain. So whenever the blood flow is disrupted, we get a stroke. The other kind of a stroke, of course, is a bleeding stroke or a hemorrhagic stroke, which is less common, and that's very good because the results are much worse. And that is usually caused by either a bleed into the brain, or called an intraparenchymal bleed, or a bleed into the ventricles, or intraventricular bleed, or sometimes if there's an aneurysm rupture, that's called the subarachnoid hemorrhage. And obviously the symptoms of that would be more of a severe headache, not your general stroke symptoms.
How common are strokes?
Strokes are very common. Obviously, they're more common in the elderly. And when we say elderly, it's 65 years and above, and I'll keep using that term until I reach 65, then it's no longer the elderly. But they actually do affect the younger patient populations, including children, and sometimes even before birth. I mean, cerebral palsy is a type of stroke that occurs before birth. But it is quite common. It is the third leading cause of death in the United States at this time, behind heart disease and cancer. But it is the number one leading cause of disability in adults, and that's a major concern as well.
What are the symptoms then of a stroke?
Symptoms of a stroke obviously would range from a wide variety of symptoms depending on what part of the brain actually gets affected with the stroke. And as you know, if the brain is function at that location is to move our right side, patients will present with right-sided weakness, which is usually the most common presenting symptoms, a lateralizing weakness or weakness on one side of the body, sometimes associated with numbness, sometimes not. Sometimes numbness can occur alone, but usually those symptoms are unilateral, one side only. Other symptoms of a stroke could be visual changes, if the posterior part of the brain or the actual occipital lobe, or even the globe of the eye could have a stroke. So you can have unilateral vision loss or one eye vision loss or changes. But if it's affecting the occipital lobe or the posterior part of the brain, it would be more of a visual field defect. So patients would say, you know, I can't see the right side of my visual field. Other common symptoms are acute onset of dizziness or vertigo or disequilibrium. And also strokes commonly affect speech. Speech problems could be anywhere from just a slurred speech to inability to speak at all. And that's more consistent with an aphasia, usually a dominant hemisphere frontal lobe stroke. It can also be where a patient is speaking normally, but they are not comprehending anything that you're telling them. And that's sometimes, you know, hard to differentiate because we get a consult for, you know, confusion, acute confusion, but really the patient is not confused. They just had a stroke in the part of the brain that translates hearing the language into actual understanding the language. And that's called a receptive aphasia.
Are most symptoms pretty dramatic so someone knows, hey, something is wrong here?
People know something is wrong, but obviously the severity is what pushes the patient to say, okay, let's go to the ER or let's call 911. But not necessarily the stroke size, because the location of the stroke is more important than the size of the stroke as far as symptoms. Now, unless it's a massive stroke, because sometimes you can get a very small stroke, but it's an area where a lot of the pathways are, being condensed. So you can have a very small stroke causing significant deficits in a patient, where sometimes you have a large stroke that's sort of silent. We all know that we don't use all of our brains, some more than others, but there's many studies done on patients who've never had symptoms of a stroke, and we do an MRI and we see 1 or 2 strokes, but they were silent strokes. So the location is important, but patients do notice something wrong. Sometimes, especially male patients, the wives notice it before the patient does. But it's very important to seek immediate medical attention, no matter how mild the symptoms are, because even though the symptoms start mild, it could be a warning sign of a larger stroke to come. So seeking immediate medical attention is urgent.
Okay, well, we're going to take a break, and when we come back, there's lots more to talk about.
Very good.